hope you're all doing well. And as mentioned, my name is Mel. I am the AOP analyst for the agency, for the Bureau Quality Improvement. And this is our first annual AOP conference, the first one that we've had in a long time, since 2017. So we thank you all for participating. And we thank you all too for your flexibility. We at first were thinking of doing this in person, but we have to adapt with the times. And we do understand too that you're all busy in your clinics working hard and you're tuning in from various ways. So we appreciate your flexibility. Also, we appreciate everything that you've been able to do to help get those AOPs up, all the hard works that you've been doing. The content that we're going to present here is mostly reminders, but also we have a variety of stakeholders here, people from the state and other members at our department that are going to present some content that you may be familiar or unfamiliar with. And this is an opportunity to get to know more information and ask questions. So please do so. Without further ado, I'm going to introduce myself. My name is Melio. You all know me, and I'm going to popcorn it to Muriel.
Good morning, everyone. Thank you for joining us today. We hope this is going to be a very informative, lively discussion. Please, as Mel said, please include any questions in the chat, and we'll do our best to answer those questions for you. I hope this will be a very helpful, informative, informational session for you guys. We did a lot of work to prepare it for you, and enjoy. I'll pass it on next to Gretchen, I believe, who will do a welcome today.
Good morning, everybody. It's great to be with you here today. My name is Gretchen Van Wy. I'm the Chief Epidemiologist for the New York City Health Department, the Deputy Director of our Center for Population Health Data Science, and the Assistant Commissioner of our Bureau for Vital Statistics, which is where we do the registration of all births and deaths that occur in New York City. Talk a little bit about the importance of birth registration today. So that's me. Okay. The importance of birth registration. You may know this already, and I think you probably do because of the work that you do, but the birth registration is an incredibly important event in a person's life, one of the very first events, hopefully, in the United States that occurs in a person's life. This certificate that we create when we create a birth certificate serves as the key legal and identification document that people have throughout their entire lives. The birth certificate is, registration of birth is a UN development goal. Here in the United States, we have near 100% registration of all the people born in the country. However, in other countries around the world, that is not the case, and it becomes a problem for many different reasons. Most importantly, birth registration is a human right because it creates the documentation that allows for having so many different human rights. Also, it connects people then to the social determinants of health, like housing and education and all the things we know people use birth certificates to get. So for all of these reasons, the birth certificate is very important, and the work that you do to provide the information about birth is absolutely critical. The birth certificate and the birth registration process also initiates many other events in the U.S. Of course, Social Security is one of the big things. On the worksheet that's completed to complete a birth certificate, there's a question that parents ask about whether or not they want their child to be getting a Social Security card. If that checkbox is checked, that parent's information is then transmitted to the Social Security Administration, whereupon the Social Security Administration can send those parents the Social Security card for that child. The birth registration process is also important for establishing the facts needed for obtaining child support, health insurance. Medicaid is a big category of health insurance in New York City. 60% of all births that occur to parents who are using Medicaid, and we send the Medicaid data, those data directly to the Medicaid office in New York State so that we can make sure that those babies get on Medicaid rapidly. In other plans, parents send their paperwork to those health insurance companies. The birth registration event also is then recorded and shared with our immunization partners who track immunization around the city, and programs like the Early Intervention Program, where we monitor milestones of children to make sure they are developing and hitting their developmental milestones. If not, we have interventions to offer to help them. So, of course, one of the very most important pieces of a birth certificate is the section where we establish parentage. There are two fields for parent. There's the mother/parent 1, and then there's the father/parent 2. And the vast majority of cases have the mother/parent 1 because that person is there to make sure the birth is happening. The second field is often not completed at the time of birth. In New York City, about 40% of birth certificates do not have that second parent listed at the time of birth. And so there is partly where the role of, that's one area where acknowledgement of parentage forms become incredibly important. And so 40% of all births in New York City, so over 40,000 births, require an AOP or some other type of documentation to add that second parent if the parents want it to be added. The AOP form is really important to ensure that children and their mothers, that first parent or that first birthing person, will have improved outcomes by securing financial support, parental rights, and improved health outcomes. So in conclusion, birth registration is important, and establishing parentage is also very critical to outcomes. We need to have and maintain birth certificates, and we're always trying to make them better. And we're always trying to make the AOPs and the other documents we use with them better. So we're really glad you're here today because you are partners in doing that. We co-create these documents. Continuous improvement for this process supports high quality data, the fair operation of society, and ensuring that the facts are correctly recorded for the children or the infants recorded on those birth certificates. And it's important then for the meaningful protection and the thoughtful protection of the public's health. Our work together today is a continuation of our collaborations, and we want to thank you very much for joining us.